guess we're live now here. So, hey everyone, here this is the Ben and Gary show, and we know dentistry, and we're here because you guys asked us questions. And one of the interesting questions that came up recently was that it had an individual who was doing a little bit of research on the internet and came across this term called, periodontal plastic surgery. And they said, what exactly is that? And why would anybody actually need it? And so Gary, I guess maybe you can start off here on answering, like, what in the world are those kind of like whole series of procedures really about, and why does anybody even need it?
Right. Well, a lot of times when people have gum recession, then they look long in the tooth and older, and so we need to have some way of regaining the tissue height. So that's what the periodontist is the specialist that works or treats the gums and the supporting bone, and so they would be the specialists that you would see for that.
Yep.
And so one of the things is, of course, recession. The other is uneven smile or gum lines.
Yeah, somebody has a lip that shows a lot, not just teeth, but teeth and gums. And if there is an asymmetry in the height of those gums, sometimes from a plastic surgery standpoint, you want to look better, look younger, look more symmetrical. And, that's what can be done to be able to pull those down,
Yeah, so what we look for as restorative dentists is, especially if we're doing porcelain veneers, is we want to have a symmetrical smile or gum line as well as creating a symmetrical smile.
Yeah, our brains are able to be able to see asymmetry really quick. Yeah. And when you're doing, for like Gary, you said, we're doing some sort of restorative procedure like crowns or veneers, and somebody's having a cosmetic improvement. Right. Part of the reason why the teeth look that good, or why they will look good in the future, is having not only just even teeth, even edges, but also even gum tissue. And the difference in heights of gum tissue show up really nicely when you finish your veneers. If you don't even, a lot of times that kind of procedure, you want it to be able to turn out right. You don't necessarily want even edges of your teeth, and then when they smile, all of a sudden you see a long tooth here, a short tooth there. It just never turns out correctly. So a periodontal plastic surgery procedure will even that out.
Because wouldn't that make you crazy just looking at that?
Well, if I invested that much time, energy, and finances into it, you certainly want to be able to have it look good in the end.
Right. So,
well, maybe before we even get into some of the discussions about what types of procedures are out there, tell me, what's the purpose of the gum tissue in the first place? Why are we so worked up about a gum getting thin or a tooth getting longer? Other than having you look a little older here, but from our standpoint, I think we think of things from a more biologic standpoint.
Right. So of course the gum tissue covers the bone, so it protects the bone. Yeah. It also, along the gum line, below the gum line, right along there, it attaches to the tooth structure.
Creates like a seal around there.
So it's like a little cuff around
like a gasket
tooth. Exactly. So it prevents bacteria from getting down along the root, and which would eventually get to the bone. It's a protective type of mechanism.
Our teeth are essentially the only thing that really pops out from our inside of our body into the oral cavity or into space outside of the body. So you obviously don't want, if that's going to happen and pop through the gum tissue, you don't want to have that bacteria that's in our mouths normally there negatively affecting the bone.
Exactly. So we could have a whole discussion about periodontal disease.
Yeah, exactly.
And the systemic effects and all that, but suffice it to say, for this discussion, it's just a protective mechanism.
Correct.
So you want to talk about the different
ways
or methods?
Yeah, I think that's a good idea. There's always a gold standard in everything that we do, and it would be great to be able to. The gold standard in this case is if you have a small area of like 1 to 2, maybe 3 teeth tops, then you can use your own gum tissue to be able to transfer it from one place to the next. And the best donor site for that is going to be the roof of the mouth. And I'm talking about taking off, a whole, sort of like piece of sod like you would, your yard. Think of it more like the thickness of your gum tissue, like a deck of cards. And you're only going to take out the cards that are in the middle, and then basically close everything back up again. And then we're going to take that small piece of gum tissue. That, by the way, the roof of the mouth is really tough, so if you're eating pizza, you burn it there. It doesn't really totally, injure you or scrape you. So that's really awesome tissue to be able to move into another place that's more delicate. So I know every time I've ever seen one of those happen, you move this gum tissue from one place to the next, and basically kind of tuck it under the gum tissue, pull the gums down, and you end up with even gum tissue after the fact.
Right.
And I've never seen anybody have to come back and have to do one another time just because it just seems to work every single time.
Yeah. It's very predictable.
Gold standard. You know. But the problem with that one, I guess, is that if you have a wider area of gum recession, and you only have but so much gum that you can take from the roof of your mouth. So if you have more than like one or two teeth, then you either have to wait a while for different procedures, or if you really kind of want to get it done all at one time, then there's other donor tissue that is actually basically comes out of a box or a bag, and that would be typically cadaver tissue. And it's the same kind of tissue that's used for individuals who have larger pieces of skin that are burn victims, coming from the same pool, but we only use it in a small, sort of a small piece. And you can use over longer, areas and more areas, and essentially there's no limit in terms of how much you can actually place because there's so much in a tissue bank.
Right.
So, so that kind of tells you that you can use your own gum tissue, and we can use gum tissue that basically comes that's not your own.
Right.
Those procedures are done so that if somebody doesn't want them, have to take it from a donor site, which is another separate procedure.
Right.
Then taking it out of a box or a bag is a whole lot easier, but they don't necessarily have as good results though.
Yeah. Easier on the patient.
It's definitely easier on the patient. And then I think there's some other techniques there that are even more or even less invasive than what we're talking about.
Yeah. So they have the Chao technique. It's called the pinhole technique, and that's been an amazing way to treat recession.
Right.
So, but basically, it's the access and raise the tissue through a very small opening, and you can go and really do a lot of teeth.
Yeah, I think they make the little small incisions kind of remote
areas,
from where you're actually doing it, and it's designed to be less invasive and still be able to have a great result.
Right. So they lift the tissue and separate it from the bone, but then they are able to move it down to cover the exposed root. Right. So and then they suture that and tighten it up. And, so I've heard that it's very predictable, and you get very good results, and it's less trauma on the patient. There's no donor tissue that's involved, and
no donor from the patient himself. There is donor tissue from the tissue bank, which is human tissue.
Right. But it's incredible. I've seen a few cases, and it's impressive.
It's very impressive. There, it's almost to me in some ways where people think about these orthopedic procedures here, where it's laparoscopically done in small holes, and it's it's the same concept in terms of just being less invasive and hopefully being able to do the same thing. It's just the instrumentation has to change. The technology is more advanced, but the end result is that the patient gets a similar result with less trauma.
Right. Exactly. So one last area that we can talk about is the indentations in the gum and the bone. So typically when you lose a tooth or a tooth is removed, over time the bone on the outside will start to become depressed.
Shrinks away,
Yeah. So just from the loss of bone thickness in the ridge.
Right.
And so and this is usually evident when we place implants. So we place an implant, but then you still have that little depression.
Depression, yeah.
And so that's when they would, periodontists would be able to place some donor tissue, usually from the palate, and just tuck it into that area and plump it out, and it just makes it look so much more natural.
Correct, and there's actually even not just an aesthetic purpose of that here, but there's also from a hygiene and functional standpoint that if you place a tooth into a place where there is a depression, guess where your food's going to go every single time that you have that here. So there is a real purpose for this, and a lot of times patients will think that, hey, we're kind of piling on procedures, and we just for the fact that we're going to line our pockets because of that here. Well, you're coming to pros because we know what happens when you go only halfway. And that honestly is the big reason why we promote it, is that there is a true functional reason why we want to recontour like it is in nature, because it's only going to then function properly, and if it doesn't, then you're going to have potential for a lot more trouble with that. And if that food and the bacteria and everything else goes to that one area, it's more challenging to keep it clean. And not being able to keep it clean usually means that there's going to be some sort of, again, recession, which we're trying to avoid.
Right, exactly.
So I guess in terms of the things that we needed to cover in terms of the kind of periodontal plastic procedures, I hope this answers your question, that person out there who asked us. And, we're going to be able to come back another time for the Ben and Gary Show. And by the way, congratulations to UVA for their NCAA championship. Finally, we got it here. Go Hoos.